Moving on to the next part is something we call that as an electrophysiologic studies, Maze procedures. We saw like there is arrhythmia or dysrythmia, right? When there is rhythmic disturbances in the heart, now the doctor has to do some kind of a surgery, okay? Now let's see an example where the patient is having ectopic beats. Usually you should know like these extra beats arise from atrium or in that annulus. So in such cases, the physician is going to ablate those ectopic, the sides of ectopic beats, which is typically the left atrium and the annulus, okay? Or sometimes it could be the septum as well, okay? This procedure to treat this arrhythmia or dysrhythmia is classified as two types as modified Maze and Maze procedure. A modified Maze is a limited procedure where the physician is going to isolate the triggers, especially from the pulmonary veins. Or if he is going to give attention to only one particular site, it becomes a limited ablation procedure, or it is a modified Maze. Now when more than one sites are being treated, like say the annulus, the septum, the interatrial septum, or sometimes it could be the any other contiguous sites of this left auricle or this left atrial appendage, in such cases you can take that as an extensive procedure or as a Maze procedure. You will have to understand two things. These Maze procedures and modified Maze procedures can be done either as a standalone procedure or as an add-on procedure. That means there is some other primary procedure wherein these Maze procedures are being done as an additional procedure. For example, they are doing a CABG for a person who has CAD, which is coronary artery disease. Subsequently, the patient also has dysrhythmia, and for that they are going to do a limited Maze. In that case, report the code for the CABG first, followed by the add-on code for the modified Maze procedure. I want to tell you one more thing regarding this pacemaker. You can figure out from the operative report itself whether they are coming for a replacement or an insertion or a removal. If it is going to be an insertion, you will be having the serial number of this particular device which is going to be inserted, especially the pacemaker and all that. In that way, you can figure out what is the reason for that encounter. Okay.